Captain Jake Morrison walked through the sliding doors of the Terran Defense Medical Center, with his chest pushed out and his head held high like he owned the place. His left leg hurt badly and he walked with a slight limp, but he tried to hide it because he did not want anyone to think he was weak. The medical center was huge and bright, with white walls and clean floors that made soft sounds when people walked on them. Jake had been here before, but never as a patient, and he did not like being here now. The building was on Luna Base, which was the biggest military hospital in the solar system. Ships came here from all over space, bringing hurt soldiers and officers who needed help. Jake could see through the big windows that showed the gray surface of the moon and the black space beyond it, with tiny stars that looked like small lights. Earth was visible too, looking like a blue and white ball hanging in the darkness. Jake was 28 years old and had been a captain for 2 years. He had short brown hair and green eyes and a scar on his chin from an old fight. He wore his uniform with pride because it showed everyone that he was important. The uniform was dark blue with silver buttons and had ribbons on the chest that told people about the battles he had been in. Jake liked when people looked at his ribbons because it made him feel special. His leg had been hurt 3 days ago during a fight with alien raiders called the Zephyrians. Jake and his men had been protecting a small colony on the edge of human space when the aliens attacked. The fight had been hard, but Jake and his soldiers had won. They had killed many aliens and saved all the people in the colony. Jake was proud of this victory, and he thought it proved that he was a good soldier and leader. The injury came from an alien weapon that shot burning energy instead of bullets. The energy had hit his leg and burned through his armor and into his skin. The field medic had put bandages on it and given him medicine for the pain, but Jake knew he needed better treatment. That was why he was here at the medical center, even though he did not want to be. Jake looked around the waiting area and saw many different kinds of people. Some were human like him, but others were aliens from different planets. There were tall, thin people with blue skin and big eyes from a planet called Centauri. There were short people with fur and long tails from somewhere else. Jake did not like seeing so many aliens in a human military hospital. He thought that humans should be treated by humans and aliens should go somewhere else. He also saw many women working in the medical center. Some were doctors and some were nurses and some did other jobs. Jake did not think women belonged in the military because he believed they were not strong enough for real fighting. He thought women should stay home and take care of children while men went to war. This was what his father had taught him, and what many people in his hometown believed. Jake sat down in a chair to wait for someone to call his name. The chair was soft and comfortable, but his leg still hurt. He took out his datapad and started reading reports from his last mission. The reports said good things about him and his men. They talked about how brave Jake had been and how he had led his soldiers to victory against the aliens. Reading these reports made Jake feel better about himself. While he waited, Jake watched the people walking around the medical center. He saw doctors talking to patients and nurses carrying supplies from one place to another. Most of the people seemed busy and important, but Jake thought they did not understand what real military service was like. These people worked in safe places with good food and comfortable beds. They did not have to fight aliens or risk their lives to protect human colonies. Jake believed that combat soldiers like himself were the most important people in the military. Without soldiers like him, there would be no one to fight the enemies and protect humanity. Everyone else was just support staff who helped from far away. Jake thought these support people should be grateful to soldiers like him and should treat him with respect because of what he did. The medical center was very busy with people coming and going all the time. Jake could hear the sounds of machines beeping and people talking and footsteps on the hard floors. Sometimes he heard announcements over the speakers telling doctors to go to different places. The whole building felt like it never stopped working and never slept. Jake noticed that many of the medical staff were not human. There were aliens wearing the same uniforms as human doctors and nurses. This bothered Jake because he thought aliens should not be taking care of human patients. He worried that aliens might not understand human bodies well enough to give good treatment. He also thought that giving important jobs to aliens took those jobs away from humans who needed them. Near where Jake was sitting, he could see a supply room where medical equipment was stored. A young woman was working there, organizing boxes and checking lists on a computer. She was black with short hair and looked to be about 30 years old. She wore medical scrubs like the other nurses and moved around the room in a quick and efficient way. Jake watched her work and assumed she was just another nurse doing simple tasks. The woman seemed focused on her job and did not notice Jake watching her. She picked up boxes and moved them to different shelves and typed things into the computer. Sometimes she would look at papers and make notes with a pen. Jake thought this looked like basic work that anyone could do and did not require much training or skill. Jake felt his leg getting more painful as time passed. He had been sitting for almost an hour, and no one had called his name yet. He was getting impatient and annoyed because he thought a combat officer should not have to wait so long for medical treatment. He believed his service record and rank should put him ahead of other patients who had not done important things like fighting aliens. The pain in his leg was getting worse, and Jake decided he needed to do something about it. He looked around for someone who could help him get faster treatment. His eyes went back to the black woman working in the supply room. Jake decided she would be the person to talk to, because nurses usually knew when doctors would be available and could maybe help him get seen sooner. Jake stood up slowly because his leg hurt when he moved. He walked over to the supply room where the woman was working. She looked up when she heard his footsteps but continued organizing the medical supplies. Jake could see now that she had kind eyes and a calm expression. She seemed like someone who was good at her job, but Jake still thought of her as just a nurse who did simple work. This was the moment when Jake Morrison made the mistake that would change everything. He was about to speak to someone he thought was beneath him in rank and importance. He did not know that he was wrong about who this person was or what she had done in her career. Jake thought he understood everything about military ranks and who deserved respect, but he was about to learn that his understanding was completely wrong. Jake walked up to the supply room where the black woman was working and cleared his throat to get her attention. She looked up from the computer screen where she had been entering data about medical supplies. Her expression was professional and calm as she waited to hear what Jake wanted to say. "Hey, nurse," Jake said in a voice that sounded like he was talking to someone who worked for him. "I need you to do something for me right now." He did not say please or use any polite words because he thought nurses were supposed to help officers without being asked nicely. Jake believed his rank meant he could tell lower-ranking people what to do. The woman looked at him carefully, and Jake could see that she was trying to figure out what kind of person he was. "How can I help you, Captain?" she said in a voice that stayed calm and professional even though Jake had been rude to her. She had noticed the captain bars on his uniform and knew his rank, but she did not seem impressed by it. Jake pointed at his injured leg and said, "I have been waiting for over an hour and my leg is killing me. I need some real pain medicine, not the cheap stuff they gave me on my ship." He spoke like he expected her to run and get what he wanted immediately. Jake thought that because he was an officer and she was just a nurse, she would do whatever he told her to do. "I understand you are in pain," the woman replied, "but I will need to examine your injury before I can recommend any treatment." She spoke like someone who knew what she was talking about and had dealt with many injured soldiers before. Her voice was steady and confident, but Jake did not notice this because he was not really listening to her. Jake laughed in a way that was not nice and said, "Look, I do not have time for trainee procedures." From someone who probably just finished nursing school last month. He looked at her, like she was wasting his time and not smart enough to understand military medicine. Jake believed that young nurses did not know enough to help serious combat injuries. The woman's face did not change expression, but Jake thought he saw something flash in her eyes for just a second. "Captain, I am qualified to evaluate and treat combat injuries," she said in the same calm voice. She did not get angry or upset even though Jake was being very rude to her. This should have told Jake that she was used to dealing with difficult people and had a lot of experience. "Qualified," Jake said and laughed again. "Right, sure you are." He looked around the medical center and saw other people watching them. Some of the other medical staff had stopped what they were doing and were listening to the conversation. Jake did not care that people were watching because he thought he was right and the woman was wrong. "Listen," Jake continued, "I need a real doctor who actually knows what they are doing, not some nurse who is just here to fill a diversity quota." He said the words diversity quota like they tasted bad in his mouth. Jake believed that the military sometimes hired people who were not qualified, just because they were women or minorities, and he thought this woman was one of those people. Several people nearby stopped talking when they heard what Jake said. A tall alien with blue skin and antennae looked shocked and uncomfortable. A human man who was cleaning medical equipment dropped what he was holding and stared at Jake with his mouth open. Even some patients who were waiting for treatment turned to look at what was happening. The woman Jake was talking to became very still and quiet. Her hand stopped moving and she looked directly at Jake for the first time since he had started talking to her. "Captain Morrison," she said, and Jake was surprised that she knew his name. "I understand that you are in pain and want treatment as quickly as possible." Jake wondered how she knew his name, but figured she had probably looked at his chart or heard someone say it. He did not think it was important and continued talking. "That is right, so can you please get me a human doctor who actually earned their position instead of getting it because of their skin color?" The silence in the medical center became very deep and uncomfortable. People stopped walking and talking, and even some of the medical machines seemed quieter. Jake could feel many eyes watching him, but he thought people were just interested in seeing an important combat officer get the treatment he deserved. The woman looked at Jake for a long moment and then said, "Captain, I want to make sure I understand what you are saying. You believe that I am not qualified to evaluate your injury because I am black and because I am a woman." She spoke very clearly so that everyone could hear exactly what she was saying. Jake felt a little uncomfortable because when she said it like that, it sounded worse than he had meant it to sound. "I just want someone with real medical training," he said. "Someone who got their job because they were smart, not because the military needed to meet some kind of numbers for diversity." "I see," the woman said, and her voice was still calm. But now there was something else in it that Jake could not identify. "And you have determined that I lack real medical training by looking at me for 30 seconds while I organize supplies." Jake was starting to feel like maybe he had said something wrong, but he was too proud to back down now. "Look, I have been fighting aliens while you have been organizing boxes in a supply room. I think I know the difference between a real combat medic and someone who just does paperwork all day." The woman nodded slowly like she was thinking about what Jake had said. "You fought Zephyrians recently," she said, and it was not a question. "The energy burn on your left leg happened approximately 72 hours ago based on how you are walking and the way you favor that side." Jake was surprised that she could tell so much just from watching him walk. "How did you know that?" he asked. "Experience," the woman said simply. "Captain Morrison, you served with the 42nd Infantry Division under Colonel Martinez. Your unit was assigned to protect the mining colony on Kepler 7 when Zephyrian raiders attacked 3 days ago. The battle lasted approximately 6 hours and resulted in 14 enemy casualties with no human deaths." Jake stared at her with his mouth open. Everything she had said was exactly right, but he had no idea how she could know all those details. "How do you know all that?" he asked, and his voice was not as confident as it had been before. "The same way I know that your field medic was Corporal Stevens and that he applied emergency burn gel and wrapped your wound with standard field dressings before giving you level 2 pain medication for the transport here," the woman continued. "The same way I know that you have been refusing to take the pain medication regularly because you think it makes you look weak." Jake felt confused and a little scared because this woman knew things about him that she should not know. He wondered if she had been reading his medical files or if someone had told her about his mission. "Are you some kind of intelligence officer?" he asked. The woman almost smiled, but not in a happy way. "No, Captain Morrison, I am not an intelligence officer," she said. "I am exactly what you thought I was when you first walked over here. The question is whether you are ready to learn who that actually is." Jake felt like the conversation had gotten away from him somehow. He had expected to talk to a simple nurse who would help him get faster treatment. Instead, he was talking to someone who seemed to know everything about him and his recent mission. The woman was looking at him like she was waiting for him to figure something out, but Jake did not know what it was. Other people in the medical center were still watching and listening. Jake could see that some of them looked angry at him, while others looked like they felt sorry for him. A few people were shaking their heads like they could not believe what they had heard. Jake was starting to realize that maybe he had made a mistake, but he did not know what the mistake was or how to fix it. The woman reached for something on her belt, and Jake saw that it was an identification scanner. She held it up so that Jake could see it clearly. "Captain Morrison," she said, "I think it is time for you to learn exactly who you have been talking to for the last few minutes." The woman pressed a button on her identification scanner and a blue light came out of it. The light created words and pictures in the air that everyone could see clearly. Jake looked at the floating display and started reading the information that appeared. At first he read quickly because he expected to see simple nurse credentials that would prove he had been right about her. The first line made Jake stop breathing for a moment. In big clear letters it said, Colonel Lisa Carter, Medical Corps Terran Defense Force. Jake read the words 3 times to make sure he was seeing them correctly. Colonel was a much higher rank than captain, which meant this woman was his superior officer. Jake felt his stomach drop as he realized he had been incredibly rude to someone who outranked him. But that was just the beginning of what the scanner showed. Below her name and rank was a list of her education and training. Jake saw Harvard Medical School magna cum laude, which meant she had graduated from one of the best medical schools on Earth with very high grades. Then he saw advanced degree in xenobiology and advanced degree in combat surgery, which meant she was an expert in treating both humans and aliens. Jake kept reading, and each line made him feel smaller and more foolish. The scanner showed that Colonel Carter had served in the Proxima Centauri campaign, which was one of the most dangerous military operations in recent history. She had been awarded the Distinguished Service Cross and the Medical Merit Star and several other decorations that Jake recognized as being very hard to earn. The information kept coming, and Jake could not believe what he was seeing. Colonel Carter was listed as the chief of xenobiology and combat medicine for the entire Terran Defense Force. That meant she was one of the most important medical officers in the military and was responsible for developing treatments for all the different alien species that worked with humans. Jake saw that she had written dozens of research papers and had invented new medical techniques that were used throughout the military. She had developed new types of surgery for use in space and had created better ways to treat the energy burns that alien weapons caused. Some of the medical equipment that had saved Jake's own life during the recent battle had been designed by the woman standing in front of him. The scanner also showed that Colonel Carter had saved hundreds of lives during her career. She had performed surgery on battleships while they were under attack and had worked in field hospitals on the most dangerous planets in human space. During the siege of New Damascus, she had operated for 36 hours straight to save wounded soldiers and had earned the nickname Angel of New Damascus from the troops she had treated. Jake realized that while he had been thinking of Colonel Carter as just a nurse, she had actually been saving lives and advancing medical science. While he had been fighting in small battles, she had been developing the techniques and equipment that kept soldiers alive. Everything he thought he knew about military medicine had probably been influenced by her work. The other people in the medical center were watching Jake's face as he read the information from the scanner. Some of them knew who Colonel Carter was and had been shocked when Jake started being rude to her. Others were learning about her accomplishments for the first time and were just as amazed as Jake was. A young alien medical student whispered to his friend, "She wrote the textbook we use for xenobiology. I cannot believe that Captain was so rude to her." An older human doctor shook his head and said quietly, "Colonel Carter has saved more lives than any other medical officer in the fleet. That captain has no idea who he was talking to." Jake finished reading the scanner display and looked up at Colonel Carter. Her expression had not changed and she was still watching him calmly. She did not look angry or upset, even though Jake had been incredibly insulting to her. She looked like someone who had dealt with ignorant people before and knew how to handle the situation professionally. "Colonel," Jake said, and his voice was much quieter than it had been before. "I had no idea who you were. I thought you were just a nurse working in the supply room." He felt stupid saying it, but he needed to explain why he had acted the way he did. "Captain Morrison," Colonel Carter replied, "what you thought does not change who I am or what I have accomplished. The question is why you thought what you thought and whether you have learned anything from being wrong." Jake tried to think of something to say that would make the situation better, but everything he thought of sounded weak and pathetic. "I made assumptions based on what I saw," he said finally. "I was wrong about everything." Colonel Carter nodded like she had expected him to say that. "You made assumptions based on my race and my gender," she said clearly. "You decided that because I am a black woman, I could not possibly be qualified for an important position in the military. You thought I must have gotten my job because of diversity quotas rather than because of my abilities." Hearing his own thoughts repeated back to him made Jake realize how terrible they sounded. "Colonel, I do not usually think like that," he said, but even as he said it, he knew it was not true. He had been thinking exactly like that for his entire military career. Captain, Colonel Carter said, "This is not about what you usually think. This is about what you thought when you saw me today, and what that reveals about your assumptions regarding people who do not look like you." Jake looked around the medical center and saw that everyone was still watching the conversation. He felt embarrassed and ashamed, but also confused because he had always thought his beliefs about race and gender were normal and reasonable. Now he was starting to wonder if maybe he had been wrong about more than just Colonel Carter. "I need to examine your injury now," Colonel Carter said, and her voice returned to the professional tone she had used when Jake first approached her. "Please sit down on the examination table and I will begin the assessment." Jake walked slowly to the examination table that Colonel Carter pointed to. His leg hurt, but the pain was nothing compared to the embarrassment he felt. As he sat down, he realized that he was about to be treated by one of the most qualified doctors in the entire military. The woman he had insulted and dismissed was now going to use her expertise to help him heal. Colonel Carter washed her hands and put on medical gloves with the smooth, efficient movements of someone who had done these actions thousands of times. She gathered some medical instruments and approached the examination table where Jake was sitting. Even though Jake had been incredibly rude to her, she was still going to give him the best medical care possible because that was her job and her duty. "Captain Morrison," she said as she prepared to examine his wound, "I want you to understand something. The treatment you are about to receive is the result of years of research and development by medical officers like myself. The techniques I will use were created by people of many different races and genders working together to advance military medicine." Jake nodded because he did not know what else to do. He was beginning to understand that his views about who was important and who was qualified had been completely wrong. As Colonel Carter began to unwrap the bandages on his leg, Jake wondered how many other times in his life he had been wrong about people because of the way they looked. Colonel Carter began unwrapping the bandages on Jake's leg with careful, precise movements that showed years of medical experience. As each layer came off, Jake could see that his wound looked worse than he had thought. The skin was burned and damaged in a way that made him feel sick to look at. The field medic had done his best, but it was clear that Jake needed much better treatment than he had received on his ship. "This is a third-degree plasma burn from a Zephyrian energy weapon," Colonel Carter said as she examined the wound closely. Her voice was calm and clinical, like she had seen hundreds of similar injuries before. "The energy has penetrated through multiple layers of skin and has caused damage to the muscle tissue underneath." Jake watched as Colonel Carter used a small scanner to examine different parts of his leg. The scanner made soft beeping sounds and displayed information on a small screen that only she could see. She moved the device slowly over his wound, and Jake could tell that she was gathering detailed information about the injury. "The field treatment you received was adequate for emergency care," Colonel Carter continued, "but it was not sufficient for complete healing. Without proper treatment, this type of wound can cause permanent nerve damage and chronic pain that will affect you for the rest of your life." This information scared Jake because he had not realized how serious his injury really was. He had thought it was just a bad burn that would heal on its own with time. Now he understood that he could have been permanently disabled if he had not come to the medical center for proper treatment. Colonel Carter moved to a cabinet and began gathering medical supplies. Jake watched as she selected different bottles and tools with the confidence of someone who knew exactly what she was doing. Each item she chose seemed to have a specific purpose, and Jake could tell that she had a clear plan for treating his injury. "Captain Morrison," Colonel Carter said as she prepared a syringe with medicine, "I am going to give you a local anesthetic to numb the area around your wound. This will allow me to clean and treat the injury without causing you additional pain." Jake nodded and tried to stay still as Colonel Carter injected the medicine into his leg. He expected it to hurt, but her technique was so skillful that he barely felt the needle. Within a few minutes, the entire area around his wound became numb and he could not feel any pain at all. "The anesthetic I just used is a new formulation that I developed, specifically for treating energy weapon injuries," Colonel Carter explained as she began cleaning Jake's wound. "Traditional pain medicine does not work well on plasma burns because the energy damage affects nerve endings in ways that normal burns do not." As she worked, Colonel Carter used tools and techniques that Jake had never seen before. She had a special solution that she applied to his wound that seemed to make the damaged tissue look healthier. She used a device that directed healing energy into his leg, and Jake could actually feel his skin beginning to regenerate. This healing accelerator uses modified alien technology that we captured during the Proxima Centauri campaign, Colonel Carter said as she operated the device. I worked with Centaurian scientists to adapt their medical technology for use on human patients. It speeds up the natural healing process by approximately 400%. Jake watched in amazement as his wound began to look better right before his eyes. The burned and damaged skin was being replaced by healthy new tissue, and the pain that had been bothering him for days was completely gone. He had never seen anything like this level of medical technology and skill. Colonel, Jake said quietly, how did you learn to do all of this? I mean, where did you get the training to develop new medical technology and work with alien scientists? Colonel Carter continued working on his leg as she answered. I started my medical training at Harvard Medical School, where I specialized in trauma surgery. After graduating, I was recruited by the Terran Defense Force because they needed doctors who could work with multiple species. She applied a special bandage to Jake's leg that seemed to stick to his skin without any adhesive. During my first assignment, I realized that human medical knowledge was not sufficient for treating the variety of injuries that occurred in multi-species military operations. I began studying alien biology and medicine to understand how to treat patients from different worlds. Jake listened carefully as Colonel Carter explained her background. He was beginning to understand that her expertise had not come easily, but had required years of difficult study and dangerous field experience. She had not been given her position because of diversity quotas, but had earned it through hard work and dedication. The real breakthrough came during the siege of New Damascus, Colonel Carter continued. We were treating casualties from 6 different species simultaneously, and our standard medical protocols were not working. I had to develop new techniques in the middle of a battle to save lives. She activated another piece of medical equipment that Jake did not recognize. That experience taught me that medical science had to evolve to keep up with the realities of interspecies warfare. I spent the next 5 years developing new treatments and training. Other doctors in advanced xenobiology, Jake, realized that while he had been learning basic combat tactics, Colonel Carter had been solving complex medical problems that affected the entire military. Her work had saved thousands of lives and had advanced human medical knowledge in ways that would benefit everyone. This regeneration matrix that I am applying to your wound, Colonel Carter said, is based on technology from 4 different alien civilizations combined with human medical research. It took 3 years to develop and required cooperation between scientists from dozens of different worlds. As she worked, Jake could see other medical personnel stopping to watch what Colonel Carter was doing. They seemed to be learning from her techniques, and Jake realized that even experienced doctors and nurses considered her to be an expert teacher. She was not just treating his wound, but was also showing others how to handle similar cases. A young human doctor approached the examination table and said, Colonel Carter, I have never seen that particular combination of treatments before. Would you mind explaining the theory behind using the Centaurian Healing Accelerator with the Andromedan Regeneration Matrix? Colonel Carter looked up from Jake's leg and smiled slightly. The key is understanding how different species heal from energy damage, she explained. Centaurians regenerate nerve tissue very quickly, but their skin healing is slow. Andromedans have the opposite pattern. By combining their techniques, we can optimize healing for both nerve and skin damage simultaneously. Jake listened to this conversation and realized that he was receiving treatment that represented the cutting edge of military medicine. The woman he had dismissed as an unqualified nurse was actually one of the most advanced medical researchers in human space. Her knowledge and skills were so advanced that other doctors came to learn from her. Captain Morrison, Colonel Carter said as she finished applying the treatment to his leg. Your wound should heal completely within 72 hours. The nerve damage will be repaired and you should have full function and sensation in your leg. Jake looked down at his leg and could not believe how much better it looked and felt. The wound that had been causing him severe pain for 3 days was now barely visible. He could move his leg normally and there was no discomfort at all. Colonel, Jake said, I do not know how to thank you for this. The treatment you have given me is incredible. I had no idea that this level of medical care was even possible. Colonel Carter began cleaning up her medical instruments with the same efficient movements she had used throughout the treatment. Captain, this is simply standard care for energy weapon injuries. Every military medical facility uses these protocols now because they have proven to be the most effective treatment available. As Colonel Carter finished treating Jake's wound, other people in the medical center began approaching the examination area. Jake noticed that they were not just curious observers but were medical professionals who seemed to know Colonel Carter personally. The first to arrive was a tall alien with blue skin and large eyes who Jake recognized as being from the Centauri system. "Colonel Carter," the Centaurian said in accented English, "it is an honor to see you working again. Your research on multi-species pain management protocols saved my nephew's life when he was injured on Kepler Station last year, Colonel." Carter looked up from organizing her medical instruments and nodded politely to the alien doctor. "Dr. Vex, how is your nephew recovering? I hope the nerve regeneration therapy worked well for his species." "Perfectly," Dr. Vex replied. "The combination of human and Centaurian techniques that you developed allowed him to regain full mobility in just 2 weeks. Without your research, he would have been permanently paralyzed." Jake listened to this conversation with growing amazement. He was learning that Colonel Carter's medical innovations had not only helped human soldiers, but had also saved the lives of alien military personnel. Her work had bridged the gap between different species and had created new possibilities for treating injuries that had previously been considered hopeless. Another person approached the group, and Jake was surprised to see that it was a grizzled human sergeant who looked like he had been in the military for many years. The sergeant's uniform showed that he was from Jake's own division, and Jake thought he recognized him but could not remember where they had met. "Colonel Carter," the sergeant said with deep respect in his voice, "I cannot believe I am seeing you here. Ma'am, you saved my life during the siege of New Damascus 3 years ago. I thought I was going to die until you showed up and performed that emergency surgery." Colonel Carter smiled slightly and said, "Sergeant Hayes, how is your shoulder mobility after the reconstruction surgery? I remember that was a particularly challenging case because of the extensive nerve damage." "Perfect, ma'am," Sergeant Hayes replied. "Thanks to the technique you developed, I never missed a single day of active duty. The doctors told me I would never be able to use my right arm again, but your procedure gave me back full function." Jake stared at Sergeant Hayes as he realized where he knew him from. Hayes had served in Jake's unit for the past 3 years, and Jake had always admired his dedication and skill as a soldier. Hayes had never mentioned being treated by Colonel Carter or having such a serious injury. Jake had assumed that Hayes had always been healthy and strong. "Sergeant Hayes," Jake said, "I had no idea you had been so badly injured. You never told anyone in the unit about having surgery or about meeting Colonel Carter." Hayes looked at Jake with surprise. "Captain Morrison, I did not know you were here." "Yes, ma'am, Colonel Carter operated on me when a Zephyrian energy weapon nearly destroyed my shoulder. If she had not been there, I would have lost my arm and probably died from the infection." Jake realized that he had been working alongside Sergeant Hayes for years without knowing about his medical history. Hayes had been able to serve effectively as a soldier because of the advanced treatment he had received from Colonel Carter. Without her expertise, Hayes would not have been available to help Jake's unit during their recent mission. More medical personnel continued to arrive, and each one had a story about how Colonel Carter had helped them or someone they knew. A young human nurse explained that Colonel Carter had developed the surgical techniques that had saved her brother's life after a shuttle crash. An alien medic from the Vega system described how Colonel Carter's research had led to new treatments for a disease that had been killing his people. Colonel Carter said, "An older human doctor, your paper on cross-species surgical compatibility opened up entirely new fields of medical research. Before your work, we thought it was impossible to adapt alien medical technology for human use." Jake listened to each story and began to understand the full scope of Colonel Carter's contributions to military medicine. She had not just treated individual patients, but had revolutionized the way medical care was provided throughout the Terran Defense Force. Her research had saved thousands of lives and had made it possible for humans and aliens to work together more effectively. A young alien medical student approached nervously and said, "Colonel Carter, I am studying your textbook on xenobiology. Your explanation of how different species respond to trauma has completely changed how we approach emergency medicine." Colonel Carter looked at the student with the same professional kindness she had shown to everyone else. "What species are you studying?" she asked. "I am Andromedan," the student replied. and I am learning how to treat humans and other species in military hospitals. Your research shows how to adapt our natural healing abilities to help patients from different worlds. Jake was amazed to learn that Colonel Carter had written textbooks that were used to train medical students from multiple species. Her knowledge was so advanced and comprehensive that it served as the foundation for medical education throughout the galaxy. The woman he had thought was just a nurse was actually one of the most important teachers and researchers in the field of medicine. As more people gathered around Colonel Carter, Jake began to feel like he was witnessing something historic. He was seeing firsthand the respect and admiration that one of the military's most accomplished officers commanded from her peers and colleagues. Everyone who spoke to her clearly considered her to be an exceptional leader and innovator. Colonel, said a Centaurian. Surgeon, the emergency protocols you developed for treating multiple species simultaneously have become standard procedure in all our military hospitals. Before your work, we lost many patients simply because we did not know how to coordinate care between different medical traditions. Colonel Carter nodded and said, the key was understanding that each species had developed medical knowledge that could benefit others. By combining our approaches, we created treatments that were more effective than any single species could achieve alone. Jake realized that Colonel Carter's philosophy about medicine was similar to what the military was trying to achieve in other areas. By working together, humans and aliens could accomplish things that neither could do separately. Her medical research was a perfect example of how diversity and cooperation could lead to better outcomes for everyone. An announcement came over the medical center's speaker system, calling for Colonel Carter to report to the main surgical suite. Jake could see that she was needed elsewhere, but she took time to finish answering questions from the medical students and to give final instructions about his care. Captain Morrison, Colonel Carter said as she prepared to leave, your wound should continue healing over the next 3 days. Please return here if you experience any problems or if you have questions about your recovery. Jake stood up carefully and found that his leg felt completely normal. There was no pain and he could move without any difficulty. The treatment Colonel Carter had given him was more effective than anything he had imagined possible. Colonel, Jake said, I want you to know that I understand now how wrong I was about everything. I made terrible assumptions about you based on your appearance, and I am ashamed of the way I acted, Colonel. Carter looked at him seriously and said, Captain Morrison, the question is not whether you are ashamed now, but whether you will remember this lesson when you encounter other people who do not look like you expect them to look. Jake nodded and said, yes, ma'am, I will remember. I promise you that I will never make the same mistake again. As Colonel Carter walked away toward the surgical suite, Jake watched her go with a completely different understanding of who she was and what she represented. He had learned that his assumptions about race and gender and military rank had been completely wrong and had nearly caused him to miss receiving the best medical care available anywhere in human space. After Colonel Carter left for the surgical suite, Jake remained sitting on the examination table trying to process everything that had happened. The medical personnel who had gathered to talk with Colonel Carter began to disperse, but many of them stayed nearby, and Jake could hear them talking about her accomplishments and contributions to military medicine. I cannot believe that Captain was so rude to Colonel Carter, said one nurse to another. She has probably saved more lives than any other doctor in the fleet. How could he not know who she was? Jake felt embarrassed hearing this conversation, but he also realized that the nurses were right to be upset with him. He had been incredibly disrespectful to someone who deserved his admiration and gratitude. The worst part was that he had been rude because of assumptions based on race and gender that he was now realizing were completely wrong. A young human doctor approached Jake and said, Captain Morrison, I could not help but overhear your conversation with Colonel Carter earlier. I hope you understand now what an extraordinary person you were talking to. Jake nodded and said, Doctor, I had no idea who she was or what she had accomplished. I made terrible assumptions and I feel horrible about it. The doctor sat down in a chair next to the examination table and said, Captain, I think you should understand the full scope of what Colonel Carter has achieved. Her contributions to military medicine go far beyond what you heard today. Jake was curious to learn more, so he asked, What do you mean? What else has she done? The doctor looked around to make sure other people could hear and then began explaining. Colonel Carter developed the medical protocols that have kept your unit alive during combat operations. The portable surgical units that your field medics carry were designed by her. The improved field medications that treat energy weapon burns came from her research. Jake thought about his recent mission and realized that his unit had used several pieces of medical equipment during the fighting with the Zephyrians. He had never wondered where that equipment came from or who had developed it. Now he was learning that the woman he had insulted had literally created the tools that had saved his soldiers' lives. The armor medical sensors that monitor your vital signs during combat. The doctor continued, those were also developed by Colonel Carter. She created a system that automatically alerts field medics when soldiers are injured and tells them exactly what kind of treatment is needed. Jake remembered that during the recent battle, his armor had detected his injury immediately and had transmitted information about his condition to the medics. That system had ensured that he received proper field treatment quickly, which had probably prevented his injury from becoming much worse. He had never thought about who had created such an advanced system. Another doctor joined the conversation and added Colonel Carter also developed the training programs that teach field medics how to treat multiple species. Before her work, human medics could only treat human patients effectively. Now they can provide emergency care to any species in the Terran Defense Force. Jake realized that this was important because his unit included soldiers from several different species. During the recent battle, alien members of his unit had been injured, and the human medics had been able to treat them successfully. Without Colonel Carter's training programs, those alien soldiers might have died from injuries that the medics did not know how to handle. She also created the medical evacuation protocols that determine how quickly injured soldiers are transported to hospitals, said a third doctor who had joined the group. Her research showed that energy weapon injuries require different treatment timing than conventional wounds. The procedures she developed have reduced combat mortality by 30%. This information amazed Jake because he was learning that Colonel Carter's work affected every aspect of military medicine. From the equipment used in the field to the training of medics to the procedures for getting injured soldiers to hospitals, everything had been influenced by her research and innovations. A Centaurian medical officer approached the group and said, Colonel Carter's research has also revolutionized medical cooperation between species. Before her work, each species used only their own medical knowledge. Now we share techniques and equipment that benefit everyone. Jake asked, how did she manage to get different species to work together? I thought aliens were secretive about their technology. The Centaurian replied, Colonel Carter proved that cooperation saved lives. When species saw that sharing medical knowledge helped their own people as well as others, they became willing to collaborate. She built trust through demonstrated results. Jake was beginning to understand that Colonel Carter was not just a skilled doctor, but was also a leader who had changed how different species worked together. Her medical research had created bridges between civilizations that had previously been suspicious of each other. An older human surgeon joined the conversation and said, Captain Morrison, I think you should also know about Colonel Carter's combat record. She did not just develop medical techniques in safe laboratories. She tested and refined her methods under fire in some of the most dangerous battles in recent history. Jake was interested to hear about this aspect of Colonel Carter's career. What battles was she in? He asked. She served as a combat surgeon during the Proxima Centauri campaign, the surgeon replied. That was one of the bloodiest conflicts humans have ever been involved in. Colonel Carter performed surgery in field hospitals while they were under enemy bombardment. Jake knew about the Proxima Centauri campaign because it was studied in military schools as an example of how difficult interspecies warfare could be. The fact that Colonel Carter had served in that conflict as a combat surgeon meant that she had more dangerous field experience than most infantry officers. During the siege of New Damascus, she operated for 36 hours straight without rest, the surgeon continued. The hospital was surrounded by enemy forces and was being attacked constantly. She saved over 200 lives during that siege and earned the nickname Angel of New Damascus. Jake had heard the nickname Angel of New Damascus before, but had never known who it referred to. He had assumed it was some legendary figure from military history. Learning that it was Colonel Carter made him realize how famous she was among people who knew about military medicine. She also developed the emergency surgical techniques that are used when ships are damaged during space battles, added another doctor. Performing surgery in zero gravity while a ship is maneuvering to avoid enemy fire requires completely different skills than normal medical practice. Jake tried to imagine how difficult it would be to operate on someone while floating in zero gravity with explosions happening around the ship. The level of skill and courage required for that kind of work was beyond anything he had experienced as a combat officer. Colonel Carter trained the medical teams that serve on all the major warships in the fleet, said a nurse who had been listening to the conversation. She personally selected and taught the doctors and medics who keep our space forces operational. Jake realized that the medical team on his own unit's transport ship had probably been trained by Colonel Carter. The medics who had treated him after he was injured had used techniques and equipment that she had developed. Even when she was not physically present, her influence was helping to save lives throughout the military. As Jake listened to more stories about Colonel Carter's accomplishments, he began to understand that she was truly one of the most important people in the Terran Defense Force. Her work had affected every aspect of military operations and had saved thousands of lives. The woman he had dismissed as an unqualified nurse was actually one of the heroes of the modern military. Jake sat quietly for a long time after the medical personnel finished telling him about Colonel Carter's accomplishments. He felt overwhelmed by everything he had learned and ashamed of how he had behaved. The woman he had insulted and dismissed was not only his superior officer, but was also one of the most respected and accomplished people in the entire military. As Jake thought about what had happened, he began to realize that his mistake went deeper than just not recognizing Colonel Carter's rank and qualifications. He had made assumptions about her based on her race and gender that revealed serious problems with his thinking about other people. He had believed that black women could not be as qualified or capable as white men, and that belief had been completely wrong. Jake started thinking about other times in his military career when he might have made similar mistakes. How many times had he dismissed or ignored people because of what they looked like instead of paying attention to their actual abilities and accomplishments? How many opportunities had he missed to learn from people who knew more than he did because he had assumed they were not worth listening to? The more Jake thought about it, the more he realized that his attitudes about race and gender had been holding him back as an officer and as a person. He had been taught these attitudes by his family and friends while growing up, but he was starting to understand that they were not just wrong, but were also harmful to himself and to the people around him. Jake decided that he needed to apologize to Colonel Carter properly and to try to make up for his behavior. He got up from the examination table and walked toward the main surgical suite where she had gone earlier. His leg felt completely normal thanks to her treatment, and he was amazed at how effective her medical care had been. When Jake reached the surgical suite, he found a nurse at the reception desk and asked if he could speak with Colonel Carter. The nurse looked at him suspiciously and said, "Colonel Carter is performing emergency surgery on casualties from a transport accident. She will be in surgery for several hours." Jake felt disappointed that he could not apologize immediately, but he understood that Colonel Carter's medical duties were much more important than his need to say he was sorry. He asked the nurse, "Is there a way I can leave a message for Colonel Carter? I need to tell her something important." The nurse gave Jake a piece of paper and a pen and said, "You can write a note and I will make sure she gets it when she finishes surgery." Jake sat down and tried to think of what to write. He wanted to apologize sincerely, but he also wanted to show that he understood how wrong his attitudes had been. After thinking for several minutes, Jake began writing. "Colonel Carter, I want to apologize for my behavior today and for the terrible things I said to you. I made assumptions about you based on your race and gender that were completely wrong and insulting. I now understand that you are one of the most accomplished and respected officers in the Terran Defense Force, and that I was incredibly lucky to receive medical treatment from someone with your expertise." Jake continued writing. "I also want you to know that I realize my mistake was not just about not recognizing your rank. I've been thinking about people in the wrong way for my entire life, and I need to change those attitudes. Your example has shown me that I have been missing opportunities to learn from people who have different backgrounds than mine." Jake finished his note by writing, "I promise that I will work to become a better officer and a better person because of what you taught me today. Thank you for treating my injury so effectively. and for being patient with someone who did not deserve your professionalism and kindness. Jake gave the note to the nurse and asked her to make sure Colonel Carter received it. As he walked back through the medical center, Jake continued thinking about what he had learned and what he needed to do differently in the future. Jake realized that he needed to examine his attitudes about all the people he worked with in the military. His unit included soldiers from several different species and backgrounds, and Jake wondered if he had been treating all of them fairly and with the respect they deserved. He thought about the alien members of his unit and whether he had been listening to their ideas and valuing their contributions properly. He also thought about the female soldiers in his unit and whether he had been giving them the same opportunities and recognition that he gave to male soldiers. Jake was starting to understand that his beliefs about gender roles might have been just as wrong as his beliefs about race, and that he needed to reconsider how he evaluated people's abilities and potential. As Jake walked through the corridors of the medical center, he saw people from many different species working together effectively. Human doctors were consulting with alien specialists about patient care. Male and female medical personnel were collaborating on research projects. Everyone seemed to be focused on doing their jobs well, regardless of what they looked like or where they came from. Jake realized that the medical center was an example of how the military was supposed to work. People with different backgrounds and different types of expertise were working together to achieve common goals. Their diversity was making them stronger and more effective rather than creating problems or conflicts. Jake decided that he wanted to learn more about how to be a better leader in a diverse military environment. He made a mental note to research training programs that could help him understand how to work more effectively with people from different backgrounds. He also decided to ask for feedback from the soldiers in his unit about whether he had been treating everyone fairly. As Jake prepared to leave the medical center, he felt like he had learned more in one day than he had in years of military training. The experience of meeting Colonel Carter and learning about her accomplishments had forced him to examine his own beliefs and attitudes in a way that was uncomfortable but necessary. Jake understood that changing his thinking would not be easy, because his old attitudes had been a part of his identity for his entire life. But he also understood that change was necessary if he wanted to be an effective leader and a good person. The example set by Colonel Carter had shown him what was possible when people were judged by their abilities and character, rather than by their appearance. Before leaving the medical center, Jake stopped at the information desk and asked for materials about Colonel Carter's research and publications. He wanted to learn more about her work and to understand how she had developed such advanced medical techniques. The desk clerk gave him several research papers and told him that Colonel Carter's textbooks were available in the base library. Jake left the medical center with a new understanding of himself and of the people around him. He knew that he had a lot of work to do to become the kind of leader and person he wanted to be, but he was committed to making that change. The lesson he had learned from Colonel Carter would stay with him for the rest of his career and would influence how he treated every person he encountered. 3 weeks later, Jake Morrison returned to the Terran Defense Medical Center for his follow-up appointment. His leg had healed perfectly just as Colonel Carter had predicted, and he could not even see where the wound had been. The advanced treatment she had given him had worked better than anything he could have imagined, and he felt grateful for her expertise and professionalism. As Jake walked through the medical center, he noticed things that he had not paid attention to during his first visit. He saw the respect that people of all species showed to each other, and the way they worked together to solve medical problems. He observed how male and female medical personnel collaborated as equals and how everyone seemed to value the contributions that others made, regardless of their background. Jake had spent the 3 weeks since his first visit reading about Colonel Carter's research and learning more about her contributions to military medicine. He had checked out her textbooks from the base library and had been amazed by the depth and breadth of her knowledge. Her work covered everything from basic field medicine to advanced surgical techniques that were used throughout the galaxy. Jake had also spent time examining his own attitudes and behavior as a military officer. He had talked to the soldiers in his unit about how he could be a better leader, and had asked them to give him honest feedback about whether he had been treating everyone fairly. Some of their responses had been difficult to hear but had helped him understand areas where he needed to improve. The alien members of Jake's unit had told him that they sometimes felt like their ideas were not taken seriously during planning meetings. The female soldiers had explained that they felt pressure to work harder than male soldiers to prove themselves worthy of respect. Jake had realized that his unconscious biases had been affecting his leadership in ways that he had not recognized. Jake had also applied for transfer to a new assignment that would give him experience working with more diverse military units. He wanted to learn how to lead soldiers from many different species and backgrounds effectively. He had requested assignment to the Diversity and Integration Training Command where he could develop better leadership skills for the modern military. When Jake reached the medical center reception desk, he asked to see Colonel Carter for his follow-up appointment. The receptionist checked her schedule and said, "Colonel Carter is currently in her research laboratory, but she will see you shortly. Please have a seat in the waiting area." Jake sat down and looked around the waiting area with new eyes. He saw the same mix of humans and aliens that had been there during his first visit, but now he appreciated the diversity instead of being bothered by it. He understood that having medical personnel from different species made the hospital more effective, because each species brought unique knowledge and capabilities. After a few minutes, a nurse approached Jake and said, "Captain Morrison, Colonel Carter will see you now. Please follow me to her laboratory." Jake followed the nurse through corridors that he had not seen during his first visit. They passed through sections of the medical center where research and development work was being conducted. Jake could see through windows into laboratories where teams of scientists from multiple species were working on medical research projects. In one lab, human and Centaurian researchers were testing new surgical equipment. In another lab, Andromedan and human scientists were studying tissue samples under advanced microscopes. The collaborative atmosphere was impressive and inspiring. The nurse led Jake to a large laboratory where Colonel Carter was working with a team of medical researchers. Jake could see that they were developing some kind of new medical technology that looked very advanced. Colonel Carter was explaining something to the other researchers, and they were all listening carefully to what she was saying. When Colonel Carter saw Jake, she finished her explanation to the research team and then walked over to greet him. "Captain Morrison," she said in the same professional tone she had used during his first visit. "How is your leg feeling? Have you experienced any problems with the healing process?" Jake stood at attention and said, "Colonel Carter, my leg feels perfect. The treatment you gave me worked exactly as you predicted, and I have not had any problems at all. I wanted to thank you again for the excellent medical care you provided." Colonel Carter nodded and said, "I am glad to hear that the treatment was successful. Please sit down and I will examine the healing to make sure everything is progressing normally." Jake sat on an examination table and Colonel Carter used a medical scanner to check his leg thoroughly. "The healing is complete," Colonel Carter said after finishing her examination. "There is no scarring and full function has been restored. You should not experience any long-term effects from the injury." Jake felt relieved to hear this confirmation, even though his leg had been feeling normal for weeks. "Colonel Carter," Jake said, "I wanted to apologize to you again for my behavior during my first visit. I have spent the last 3 weeks thinking about what happened and learning about your accomplishments. I realized that I made terrible assumptions about you that revealed serious problems with my attitudes about race and gender." Colonel Carter looked at Jake carefully and said, "Captain Morrison, I received your written apology and I appreciate your recognition that your behavior was inappropriate. The more important question is what you plan to do with what you have learned." Jake took a deep breath and said, "Colonel, I have applied for transfer to the Diversity and Integration Training Command. I want to learn how to be a better leader in a diverse military environment. I also want to help other officers avoid making the same mistakes that I made." Colonel Carter seemed interested in this information. "What made you decide to request that assignment?" she asked. Jake thought carefully about how to answer. "Colonel, I realized that my attitudes about race and gender were not just wrong, but were also making me a less effective officer. I was missing opportunities to learn from people who had valuable knowledge and experience because I was making assumptions based on how they looked instead of focusing on their abilities. I also realized," Jake continued, "that the military is becoming more diverse and that officers who cannot work effectively with people from different backgrounds will not be successful in their careers. I need to develop better leadership skills if I Want to serve effectively in the modern Terran Defense Force? Colonel Carter nodded approvingly and said, Captain Morrison, that shows good insight into your own development needs. The military does indeed require leaders who can work effectively with personnel from many different species and backgrounds. Diversity is one of our greatest strengths, but only if leaders know how to utilize it properly. Jake asked, Colonel, do you have any advice for me about how to become a better leader in a diverse environment? I want to make sure I learn from this experience and become the kind of officer the military needs, Colonel Carter thought for a moment and then said, Captain, the most important thing is to judge people by their abilities and character rather than by their appearance or background. Every person you encounter has the potential to teach you something valuable if you are willing to listen and learn. She continued, you should also understand that diversity brings different perspectives and approaches to problem solving. When people from different backgrounds work together, they often find solutions that no single group could discover alone. Your job as a leader is to create an environment where everyone feels valued and can contribute their best efforts. Jake listened carefully to Colonel Carter's advice and realized that it reflected the same principles that had made her successful as a medical researcher and leader. She had succeeded by working with people from many different species and by combining different types of knowledge to create new solutions. Colonel, Jake said, I want you to know that meeting you has changed my entire perspective on leadership and on the kind of person I want to be. Your example has shown me what is possible when people are judged by their abilities rather than their appearance. Colonel Carter smiled slightly and said, Captain Morrison, the universe is vast and full of different types of people with different strengths and capabilities. Humanity's greatest achievement has been learning to work with other species as partners rather than trying to dominate them. That same principle applies to working with people who look different from yourself. As Jake prepared to leave the laboratory, he felt grateful for the lesson that Colonel Carter had taught him. He understood that changing his attitudes would be an ongoing process that would require constant attention and effort. But he also understood that the change was necessary and worthwhile if he wanted to be an effective leader and a good person. Jake left the medical center with a commitment to continue learning and growing as a leader. The experience of meeting Colonel Carter had shown him that his assumptions about race and gender had been not only wrong, but also harmful to himself and others. He was determined to become the kind of leader who could bring out the best in people, regardless of their background or appearance.